No, Dr. Seviour is gonna.
Good afternoon, and thank you very much for joining us here today at this unscheduled briefing. My name is Dr. Rosann Seviour, and I am currently the Acting Chief Medical Officer of Health. Dr. Fitzgerald is taking a well-deserved vacation for a couple of weeks. So I just wanted to update you on the case and numbers in the province at the moment. So since our last media advisory, we have 23 new confirmed cases in our province. 2 cases are in Western Health, one of which is travel related, and the other is related to the outbreak in the Central region. 21 cases are in Central Health, one is related to travel, and the remainder are under investigation or related to the outbreak or a contact of a case in that region. 13 of these are previous cases that were reported as presumptive positives. There are 15 new presumptive positive cases in Central Health, and there have been 3 new recoveries in Eastern Health, and that leaves us currently with 77 active cases in the province. 1 person is in hospital as a result of COVID-19. In terms of Baie Verte, we have a total of 42 cases now linked to the outbreak in the Baie Verte region. We can confirm that there is community spread of COVID-19 in this area. Central Health is working very hard and diligently to trace all contacts and cases. If you are in the region and just have even 1 symptom, and that symptom is mild, please get tested. If you have been identified as a close contact of a positive case, please follow the instructions that are provided to you by public health. If you do not have symptoms and have not been instructed to self-isolate for any reason by public health, please be aware of the recommendations now under the alert level 3, which began early this morning. As a reminder, households can interact with up to 10 close and consistent contacts from outside their household. We know that this outbreak is related to the Delta variant, which doesn't really come as a surprise as we see the Delta variant overtaking all others across this country. We know that the Delta variant spreads rapidly and can cause a more severe illness than the original COVID-19 strain. The most important way to protect yourself and your family is to be vaccinated. If you are in this region and you are not fully vaccinated yet, please do so to protect yourself, your family, and your community. The vaccination rates in this region need to be higher in order to provide an effective barrier from COVID, and that is the same across this great province. Clinics are available in Baie Verte and Lassie. There are additional clinics planned for tomorrow in Middle Arm and at the Middle Arm Town Hall from 10 to 6, and on Friday in Baie Verte at the College of the North Atlantic from 10 to 6. Vaccinations are a very effective way of preventing severe illness, hospitalizations, and death. We also know that areas with higher vaccination rates are to have much better protection against COVID-19 outbreaks. Unvaccinated individuals are 12 times more likely to acquire COVID-19, 34 times more likely to be hospitalized with COVID-19, and 8 times more likely to die from COVID-19 when we compare them to those who are fully vaccinated and in the same age group. It is important that children remain in school. This is a priority. Schools should be the last to close and the first to open for the physical and emotional well-being of children and youth. At this time, we have no cases in school-aged children in the region, and there's no reason that schools in the area cannot continue to operate. Additional measures were implemented in the school today. If this changes or at any point in time, if a public health investigation shows that there is increased risk or transmission within the school, then we would certainly change this approach. So as a final plea across this entire province, not just the Baie Verte Peninsula, but to get vaccinated and protect those under age 12 who also cannot get vaccinated yet. Thank you, and stay safe.
Thank you, Dr. Seviour. We have 2 media in person and 3 joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
Dr. Seviour, I want to ask about vaccination rates. We know that Notre Dame Bay has the lowest vaccination rates of anywhere in Newfoundland. What role is that playing in the outbreak we're seeing right now? And give us a sense, how many of these cases that we're seeing are people who are vaccinated versus unvaccinated?
So you're absolutely right, Peter. The vaccination rates do play a role, and this area, the vaccination rates are lower in the Baie Verte Peninsula, and so we encourage people and that to get vaccinated. And I think people sometimes, don't get vaccinated. I think one of the biggest reasons is Newfoundland is we have been so fortunate. We haven't turned out to be Alberta or Ontario or Quebec, and many people feel that they're safe here in Newfoundland and that COVID isn't really a condition, a serious threat here. And they're busy with other things in their lives. So I think sometimes when we see that as we open up, we're going to get introductions of COVID-19 in the province, and that the best way that people can protect themselves and their family is to get that vaccination, is to get the shot.
And can you give us a sense of what's the epidemiology that you're seeing here? How is the virus spreading? Is this social gatherings? Is this people just picking it up in the community, household contacts? What's happening?
Yeah, so one of the biggest things that we notice, Peter, is that people with mild symptoms, once again, I think because we've been so successful, people with mild symptoms aren't getting tested. So they're thinking, oh, it's just the cold, masks were gone, we had a bit of circulation of rhinovirus, the typical things that we see, and people think, oh, it's just that, and so I don't really need to get tested. So that's a big issue, I think, for us here in Newfoundland. And then we see Delta. Delta loves a family dinner. It likes that close contact, and I think that's the other piece. I think in the ways we protect ourselves is those public health measures. We kind of layer them on. They're our armor and protection. So mask wearing is one of those. Washing our hands, and then really limiting our contacts. And in public health, one of the ways we limit people's contacts, because we know COVID loves a crowd, is that we move to, when we see we have a community spread in an area, we move back a level, and in that level, we really, the purpose of that level is to decrease the contacts that people are having. And I know this has been really tough for people, and it's really difficult times, but I think also incredibly encouraging is the vaccination rate in this province. Newfoundlanders have been some of the best across this country for coming forward, sticking out their arms and taking the jab. So I think that's also a really good positive note here.
Thank you.
Our next questions are from Jody Cook with NTV. Please go ahead and make your way to the mic.
Good afternoon. So with the drive up in cases, wait times for testing are through the roof right now. Naturally, people calling today, not able to get appointments until Friday. You mentioned some new clinic openings coming up. Do you expect that to alleviate some of the stress, or will we continue to see some of these backlogs like we saw last February, March?
So I can't tell you what the wait times are now at the moment, because I don't know at the moment, but I know public health is working diligently to get people tested and to contact them. And so I always ask people to be patient. It does happen that suddenly when we have a burst in an area, sometimes those wait times can be extended, but certainly we're working hard to improve that. And the clinics that I mentioned are vaccination clinics that are being set up in that area to allow people to get the vaccination.
On the education front, we've seen today a move to cancel public exams in the coming year, and we've also seen some changes in alert levels. What do you tell to parents who might be really hesitant, particularly in these areas where we're seeing community spread, who just simply don't want to send their kids to school tomorrow?
Yeah, so, and I can see why people, get scared, and especially if they haven't had much COVID in the area before. But we also know that, it's the COVID in the community can be reflected in the school. So we watch that diligently. And at the moment, when we see transmission in the school, we operate differently. I mean, we've seen multiple times where we might have a case in a school that's related to travel, and there's no spread in the school. The spread, in fact, is happening within the family. And so I know sometimes people are saying, well, why didn't you close the school? But those are the things we look at. And so what we'll do is if we have a case in the school, we'll look at the close contacts around them and isolate those contacts. And it's really, important that children remain in school. They've had a rough go of it. Everybody's had a rough go of it for the last year and a half, but children especially. They need their friends. They need their teaching. They need that social interaction is key. And so Dr. Dutt and I had a discussion about this last night. I mean, every time, we talk about all the elements and what can we do? What can we do to make it safer? And I know sometimes there's a gut reaction, shut the school, but that's not really the solution. And we had this discussion, and extra measures were implemented in the schools. Education has a wonderful plan where they talk about, low prevalence or increasing prevalences and what measures you can put in the school to prevent any spread, and that's what we enacted.
We will now go to the phone. Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you, Dr. Seviour. Communities in the Baie Verte area are in alert level 3 at the moment. What would it take for that area to move back even further, say into alert level 4? And is any consideration being given to that?
So at the moment, it's a great question. So at the moment, no, there's no consideration being given to that. We've just moved into this alert level. We're still getting a good handle on the situation in the area, and looking at where spread is, and getting everybody tested that needs to be tested, isolating those who need to be isolated. And so there's no thoughts of going back further at this moment, but based on what we see over the next coming days, and we always keep those kinds of things in our pocket as one of our tools. But right now, the move back, the one step, is perfectly adequate to deal with what we're dealing with. And as I mentioned, it's our way of controlling really the number of contacts people have, and when we reduce that number of contacts, we reduce the spread and the ability of the virus to spread. And
testing has been mentioned a couple of times now. Given that community spread has now been confirmed in the area, is any consideration being given to asymptomatic testing of individuals?
Also a great question. Yeah, so we start really with that symptomatic testing, and especially since, we became aware of that there was, hesitancy to get tested, or there was some testing, people with symptoms who weren't getting tested, which we've seen multiple times. That's been seen all across this country, where people, they think, oh, I'm probably fine, and it's probably not COVID. So in the moment, we're keeping it with symptomatic testing started, and also we always test asymptomatic when we have close contacts, and we test using PCR. PCR is our best test to well-timed to decrease our false negative rate with a test. So it's PCR testing for those who are symptomatic, and certainly within any asymptomatic contacts of cases would be tested. We haven't considered yet going to broader asymptomatic testing, and whether that will come in the coming days will depend on what happens overall.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. I'm wondering, our current caseload with the current caseload and the situation, the community spread announced today, is this situation taking public health by surprise?
No, I wish I could say it was. It's not. I mean, I think, we know there's a fourth wave occurring across this country, and we're part of this great country, and so we knew we were going to have isolation, we were going to have introduction events, which, is our fancy way for saying COVID's going to get across our border. So we knew this was coming, and, we're prepared for it, and I think it's always a shock to people because, nobody wants to have COVID in their community. So once again, I think the best way then that we deal with it is, if you have symptoms, get tested. If you're requested to isolate by either a public notification or when requested by public health, that you isolate effectively, and that you get vaccinated. And the last piece is those measures that we sometimes forget about that are still basic public health measures, and that's the washing of your hands, limiting your contacts, and wearing your mask. And as everybody knows, there's the masks have returned across the province, and we know that masks are an effective level of protection.
Thank you. I'm also wondering, given that we know that there's a long-term care or a personal care home in Baie Verte involved, are we looking at perhaps introducing mandatory vaccines for healthcare workers and long-term care workers?
So all those conversations are always on the table. I think they're on the table across this country, but there's no announcement imminent, at the moment. But certainly, all those conversations are ongoing here and at the national table. I mean, Newfoundlanders, I feel very proud and want to congratulate Newfoundlanders on how good they have been, at getting vaccinated, and they've stuck out their arms all across this province to protect themselves, their family, and their community. And I know I recently had to travel for work, and I noticed, flying from Newfoundland to Ottawa, all the Newfoundlanders stayed in their seats till the rows before them got up, and they never crowded the centre aisle. And I was so remarked at that difference when I got to Ottawa and everybody was in the centre of the plane. So I just think the way Newfoundlanders have dealt with this, with COVID in the last year and a half has been exceptional, and I think it's shown in our numbers. I think, everyone from the front lines to the public health team here in the province and to, all the people that have helped in this pandemic, but mostly the people of Newfoundland, that every time we've asked them to make the sacrifice of limiting their contacts or wearing a mask, they've stepped up to the plate and they've done that. And I think that's why we've done so exceptionally well.
Thank you.
Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Good afternoon. Do we know if there were any cases in schools in the Baie Verte area?
So at the moment, there's no cases in school-aged children. So there was some closure of schools, but it was more due to operational issues that decision was made, is what I've been told.
I've spoken to some parents in St. John's who are not happy with the way COVID testing and the various situations that are developing in mcdonald Drive, for example. Why is it that parents are not informed more broadly about these situations rather than having to wait and hope someone contacts them?
So yeah, and I think it's because people don't fully understand sometimes, Peter, how it works. I mean, the one thing in public health, and that's a long-standing key element of public health, is that we never, talk about people on an individual level, what classroom they're in, what school they're in, because it can stigmatize people, and people in this province have been stigmatized when they've had COVID-19 through no fault of their own. Nobody gets up in the morning and says, I hope I get COVID-19 today. So I think that, what happens is, and much of this is behind the scenes, so, that public health reaches out. We have a standard protocol that we've been using for, since the pandemic began, based on other protocols we've used over decades, and we've modified, I'll tell you, that COVID-19 protocol with all new evidence in the last year and a half. So what happens is that cases are contacted directly. They're given directions, and then contacts of cases are also given direction in how in what they need to do, and because they're a contact. And so that's why, it's more specific to the people involved, and we try and maintain people's privacy at all costs, really.
Thank you.
I'll now go back to Reach Reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do, and that's about the situation at mcdonald Drive Elementary. We saw from the news releases that the cases in the school there were tied to international travel. For people under the age of 12 who are unvaccinated, they don't have to isolate, but that means they could come back from a trip to Alberta or internationally and go right to school. That's raised a lot of concerns with parents who are afraid of, and we've seen now the introduction of cases into school. Why not say, if you traveled outside of the province, you can't come to school without either testing or an isolation period?
So, and that's a good question. So this was our decision when we decided to open, when we decided that we had to learn to live with COVID, and that also we want to keep children in school. So we know that we're not going to be able to prevent all cases of COVID across this province, and we know we're going to have some cases of COVID, and we feel we can manage them effectively. So that was where some of the decisions that came behind, or some of the information, some of the goals that came behind that decision.
Jody Cook with NTV, do you have a final question?
Yeah, thanks. So we do know that breakthrough cases obviously are existing here, and we know that the Delta variant is the primary cause of that. Fortunately, we're not seeing hospitalizations at this point. Do you fear or have concern that that is people's hesitation for not being vaccinated because perhaps they think it's not stopping me from getting the virus regardless?
Thanks for that question, because I think that is an issue that I see raised in the media often and written print, that people are saying, well, why get the vaccination if I can get COVID anyway? But what we know, we always knew that no vaccine's perfect. No medication is perfect. No person is perfect. So we always knew that there was going to be some level of infection of people, even with the vaccination. But what we're thrilled with as public health physicians across this country is that we see its impact in terms of hospitalization, in terms of severe illness, and in terms of death. And so that's why I searched around before I came on, really wanted to give you those numbers, because I think they're quite, they speak for themselves, that, if I compare across age groups, that if I take people that are unvaccinated and I take people that are vaccinated within the same age group, we know you're 12 times more likely to get COVID-19 if you're unvaccinated versus that cohort of vaccinated in your same age group. And you're 34 times more likely to be hospitalized if you get COVID-19 and are unvaccinated compared to a person who's doubly vaccinated. And we also know that you're 8 times more likely to die. So that's led many physicians across this country and to call this the pandemic of the unvaccinated. So I think those are important numbers. And then people say, well, I'm seeing more people with COVID-19 who are vaccinated or hospitalized, and what we are finding is that tends to be those over 70, 75, so the sort of more towards the elderly and the sick. So we know that vaccine provides protection. Is it perfect? No, and we never did expect it to be. There's nothing in life that's perfect, but it's damn good.
Richard Duggan with VOCM, do you have a final question?
Yes, I do. Given the high number of cases and contacts related to the Baie Verte cluster, is there any concern that this cluster could extend beyond the areas currently in Alert Level 3?
So that's something we'll be assessing, and we're always looking at that. I've had multiple conversations with the medical officer of health in that region today, and with our provincial epidemiologist, who's excellent at her job and is helping us look at all those connections and risks. And right now it's looking like it's there in the Baie Verte Peninsula, and that's where we focused our efforts in terms of moving back the alert level. And that's what we do. Each time we reach out to the community, we look at where the cases are happening, and we ask the community, who have the community knowledge of the connections between communities, of where's the best place to put that alert level, and that's what we did again this time.
Sarah Smelly with the Canadian Press, do you have a final question?
Yes, I do, thanks. Just wondering, with respect to the Baie Verte cluster, how many cases are in the personal care home and how many are, outside in the community?
I don't have those numbers right on me. I have them somewhere in one of my multiple meetings from today, but I can get you those numbers, but I do not remember that number. I've had a lot of numbers go through my head today, so I'm not sure if I can. I can't give you that number right now. But I can. I certainly can get you that number.
Thank you.
Peter Jackson with the Telegram. Do you have a final question?
Yeah, I'd like to also ask about the care home. Most of the restrictions, including masks, hand washing, have remained in place for these facilities. I think a lot of people would be worried. How do you think cases like this would have infiltrated those defenses?
Yeah, so we don't know at the moment what the source is, but we know that that if we have people, with mild symptoms that they don't think they have COVID and they visit, or if we have people who are in that asymptomatic, pre-symptomatic, pre-symptomatic phase and they visit, we know that they're still infectious, up to 2 days before they develop symptoms. So that's always, kind of where we've had it. And of course, in Newfoundland, travel is our introduction point.
Okay, thank you.
Thank you, everyone. Dr. Seviour, do you have any final comments for today?
No, I want to really thank people for taking the time to come, to ask questions, to listen. And I guess my final thing is to say that, I hope that people avail of the vaccination clinics. And I know the public health nurses out there, even in the area, are working very hard and across this province to provide, excellent access to vaccination and encourage people. We're doing really well in this province, and I encourage people to stick out their arm, get their jab, and let's see if we can get the highest rate in the country.
Thank you, Dr. Seviour. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker.